So I want to thank you again for joining us. It's been a year since we addressed various groups on Vancouver Island, and we felt that it was time for an update on the activities of the Fair Care Alliance and what we've been working on. And trust me, since our campaign promise of a new tower, we have been working diligently behind the scenes. And you've seen bits and pieces, but we're going to give you a little bit more fulsome picture today of what's actually going on in the background. Just for your information, the agenda today is you're going to get to hear from me quite a bit, and I'm Donna Hayes, if you don't know who I am. We're going to hear from our doctors directly. We're also going to hear from our Hospital Foundation rep. Barney Ellis-Perry's here with us this evening. And then graciously, Stephanie Higginson, our MLA, and Janice Perino from the Regional District Hospital Board have agreed to join us as well. So we're hoping to give you a very fulsome picture this evening of what's happening with respect to the tower and services for Nanaimo. Now I'm not controlling the clicker, but someone else is. For those of you who have not heard us speak before, we thought we'd briefly remind you about who Fair Care is. And I should just mention we are live streaming tonight. If you want to connect into that, you just have to go to the Fair Care Facebook page, and there's a link there. And so we have people watching us from all over who are tapping into our live stream. So who is the Fair Care Alliance? We are a citizen-led advocacy group working to bring equitable, comprehensive healthcare to all of Vancouver Island. We're rooted in research, lived experience, and strong community partnerships, which you'll see tonight. We're focused on bringing life-saving infrastructure services to NRGH, the only tertiary hospital serving Central and North Island. We are a coalition of groups, and we are completely nonpartisan, so we are not politically based. We are made up of medical, business, Indigenous, philanthropic, regional. We have volunteers and supporters throughout Central Vancouver Island, and we are truly a very diverse group of community advocates who are out there advocating for access to fair and equitable health care on behalf of the nearly 500,000 people who live north of the Malahat. I'm really excited about this next slide because there's a picture of the hospital in 1963. It looks brand new and shiny back then when my grandfather came to build it, but it's over 60 years old now. And he would be the first to tell you that it's time for our major tower to be replaced. We need new infrastructure. Currently, we have 354 beds, but we treat over 400 patients every single day. So if you've heard me speak before, you've heard me speak about this. These are patients in hallways, patients in storage closets. If you've been to the emergency room, you see for yourself what's going on there, and hopefully you haven't had to experience that. But it is not a very happy situation when you attend our hospital. Particularly, at quoting a report from last week I attended at the Nanaimo Chamber of Commerce luncheon, when we heard from Island Health, we are the busiest emergency room on Vancouver Island. And I just want to take a brief pause here because you are going to hear from our doctors tonight, and they are providing excellent care. So when I talk about there aren't enough beds at the hospital, I'm not talking about the care you receive from those nurses and doctors who work overtime, who put in all the extra effort. Our rates of survival are high. Our physicians, our supporting staff, our nurses, these people are working overtime and doing a stupendous job at providing that care to our community. But their infrastructure is old and lacking. Half of Vancouver Island's population receives roughly 1/3 of the healthcare resources. So there are huge disparities between those living South Island and those living Central and North Island. And the Central Island region does not have a cath lab. So if we're talking about heart disease, those of us that live north of the Malahat live below the Canadian standard of care. Here's a few statistics, and things have changed in the last year. And that's what we want you to realize as we have this conversation. Vancouver Island is growing. Doesn't matter where I travel lately, everybody talks about Vancouver Island. They want to move here, they want to retire here, and we are all here. We know why we want to be here. This is a great place to be. So we are overall growing. Victoria right now has about 460,000 people. Central North Island has grown to around 490,000. It's not going to be long till there's over 1 million people living on this island. In terms of tertiary beds, not specifically hospital beds, but tertiary healthcare beds, Greater Victoria has 844. Central North Island, which is our hospital at NRGH, has 354 beds. As you know, I said it at the beginning, we have 0 cardiac catheterization labs. There are 2 in Victoria, so if you need those services, you will have to get yourself, whether that's through helicopter or ambulance or some other form, to Victoria for those procedures. But let's talk about cardiologists. And these will be hospital-based cardiologists. So in the last year, since I spoke to you last, they've grown the cardiology team in Victoria. There are currently around 26 now, and the majority of those work within hospitals. The sad news at NRGH, we have gone down in cardiologists. So we have 2 working in community, but only 1 actually working in our hospital. Last time I spoke to you, we had 2 full-time cardiologists working in our hospital. We now have 1. And I just told you there's 490,000 people who rely on that 1 cardiologist at our hospital. These other statistics I've shared with you in previous presentations. It's just to show the disparity. Neurology, South Island has 15, we have 3. Oncology, there's more than 40 in Victoria, there's 0 here. Now, exciting news. If you've driven by the hospital recently, you see fences and excavators and dirt piling up, and there's a cancer center coming. So I suspect that number is going to change dramatically. But there's still over 40 of them in Victoria, and hopefully we get some equivalency as that cancer center comes out of the ground, hopefully by the end of 2028. Gastrointestinal, 16 in Victoria. There's only 3 in Central North Island. Psychiatrists, I mean, I think everybody here knows the mental health conversation, right? It's a really disturbing conversation. But there's 93 South Island. There are 19 north of the Malahat. The list is extensive, and we invite you to go to our website to get, if you want to know what other specialties look like. So it's been a year. There was a promise nearly a year ago. We saw it on the front of every newspaper. You saw it on television. And it was that we were promised a new patient tower for Nanaimo if the NDP government was re-elected. So it was made during the election campaign. And to be quite honest, both parties made this election promise. And what we're asking now as Fair Care is a year has passed and we've seen no progress so far on that conversation. Since then, these are the other things you've seen in the press. If you keep up on what's going on in media, October 16th, 2024, there was a conversation where Premier Eby and Mr. Rudstead committed to a cath lab in Nanaimo, and that came out of whatever presentation this is in the press. And then we heard the Nanaimo Regional Hospital Board stepped up to say that they would pay for the business plan. These are exciting pieces, and I know Janice Perino will speak to that today. That was in February of 2025. The medical staff, recently, October 2nd of 2025, the medical staff, the doctors and attending physicians that work at NRGH have created their own petition, and over 240 of them have signed a petition calling on the province to deliver the promised patient tower with specialized service, including an immediate commitment to the establishment of a cardiac catheterization service and appropriate separate infrastructure within a 3-year period. So your doctors have taken a stand and they've signed a petition moving forward. But since then, there's been no official update from our elected officials on what's happening with respect to the hospital tower, and if there's a plan coming forward for a catheterization lab. So there have been promises made and promises broken. We have a little video that's going to play right now.
Vancouver Island. Warning that without one, lives would be lost. 19 years later, our region, with over 490,000 residents, is still waiting. Patients in Central and North Island suffering heart attacks face fatal outcomes. Lives are at stake. It's time for our government and health leaders to act. Fair Care needs a cath lab for our region, now.
So here's a sample of some of the commercials you should see that are going out through the media. I think if you missed the first part of that, it said in 2006 there was a report issued about the immediate need for a cath lab to be established at NRGH. And our point taken is, you know, it's 2025, it's 2026, that's nearly 2 decades ago, and we're looking for progress on that report. Now, it's my honor to start the conversation with our physicians. Our first doctor to speak is Dr. David Forrest. He is, every time I see him, I just have to say, every time I see him, he's in ICU. So you'll see that today he's in here in his scrubs, because I know he had to escape actually to come out here and give us a presentation. But Dr. Forrest is an infection control doctor, and he's coming to speak to us about what's actually happening in the hospital and what those needs look like from the medical perspective. Dr. Forrest, could I have you come forward, please?
Thank you. Next slide. Yes, you got that one. That's perfect. Yeah, thank you. So again, my name is David Forrest. I'm an infectious diseases and critical care physician in Nanaimo. I'm also president of the Medical Staff Association, and I'm speaking to you tonight in that capacity as representative of the medical staff of Nanaimo, which numbers somewhere around 280 physicians. What I want to talk to you tonight about is a critical condition, which is the need for expanded services in Nanaimo, which is long overdue. Next slide, please. I have to do this on here too, don't I? Okay. So the need for new tertiary services and a new patient care tower has been acknowledged for a long time, for 20 years, and it's been planned really since 2010. This is critical as our population here grows and ages. It's needed to serve not just Nanaimo, but all of Central and North Vancouver Island. The new patient care tower is needed to accommodate new services, tertiary services, and to meet the growing demand and occupancy that is required for that. It's also needed to replace an aged structure that Don already alluded to, which is too small to meet the current demand, far less future need, and which is unsafe and cannot be renovated. This has been promised by all parties in the last provincial election campaign. It is needed as soon as possible. It was planned initially in 2010. Nothing has happened. It is needed as soon as possible. Next slide, please. But the first thing we need is a cardiac or heart catheterization program. We need that first. It's the first phase, if you will, in the expansion of tertiary level services in Nanaimo. It's needed now because of the increasing burden of cardiac disease in Central North Island, which exceeds that in South Island. We need local and immediate access to catheterization for patients with heart attacks. Having cath labs in Nanaimo doesn't help that. And I want to explain to you why this is important. Angina or myocardial ischemia is a problem because of poor blood flow to the heart in the blood vessels that supply the heart with blood because of blockages, like rust building up in a pipe. And that causes pain when the heart is working too hard because it doesn't get enough blood supply. A heart attack is caused when a clot forms at that area of narrowing in the blood vessel. And without relief of that blockage, the heart muscle dies. So relieving that blockage as soon as possible is critical. Back in the 1980s, we developed these clot-busting drugs, which dissolved the clots. Great, it got the blood flowing again, but you still had a narrowing in the blood vessel. So you do a procedure called an angioplasty to open up that blood vessel. Guess what? Studies that were done last century demonstrated very clearly that that procedure when you have a heart attack works better than getting the clot-busting drug. It prevents death, it prevents complications of the clot-busting drug, it's more effective, and it saves heart muscle, which means your heart returns to pump better. So you have to access that as soon as possible, because as I say, you've got only minutes to open up that blood vessel. 90 minutes, you have to be able to access that procedure. And it's only if you have access to it locally that you can benefit from it. It doesn't matter how many cath labs there are in Victoria, Without a cath lab here, it won't be accessible. So the other important thing here about a cath lab is that it can't simply be included in a new tower. The cath suite infrastructure, the building, has to be adjacent to emerge. Why? Because you need to get to the cath lab as soon as possible. Minutes mean muscle in a heart attack. The sooner you can get that artery opened, the better. And so you need to shave as much time off as possible in getting to the cath lab, and having it adjacent to emerge is critical. A new patient care tower on the Nanaimo campus actually can't be located adjacent to emerge. And so it's not going to be possible. It needs to be a separate structure. Furthermore, a new tower can't be built now. It's going to take at least 8 or 10 years to build, even if the government committed to doing it right now. We need a cath lab immediately, within 3 years. Next slide. So why is this urgent? You know, I have been practicing here for 21 years, and we have been frustrated as a medical staff seeing patients suffer as a result of lack of access to immediate catheterization services. I want to give you 3 patient stories tonight. I've been working in the ICU 3 of the last 6 weeks, and these are all recent stories, including one this week, which has particularly got me angry. So the first is a 68-year-old man who had a history of heart disease, coronary artery disease, who presented to our emergency room in May with unusual chest pain. The emergency doctors thought, we think this is a problem with poor blood flow to the heart or angina. And so they re-referred him to his internist to organize the stress test, which was grossly positive. There was clearly evidence of poor blood flow to the heart. So he requested an urgent angiogram to investigate this further. Can I have the next slide, please? Now, these are the wait times that are advised. These are the provincial standards. These are not island health standards. These are provincial. If you need a cath emergently, that should be provided within hours. If you need it urgently as an inpatient, it should be provided in 24 to 48 hours, a maximum of 5 days. An urgent outpatient catheterization should be provided within 2 weeks. An elective one can wait 6 weeks. Well, 3 months after this patient had been referred for an urgent outpatient catheterization, he was in the parking lot in Walmart when he suffered a cardiac arrest. He was resuscitated on scene. He was brought to the emergency department. He arrested twice in the emergency department, once in the ICU. We were able to successfully resuscitate him. He woke up, amazingly, after all this. And we referred him immediately to South Island to get a cath. 24 to 48 hours is the wait time. He waited 3 days. He got down to the cath lab there. They identified that he had multivessel disease. He needed bypass surgery. He waited on the ward there for a few days. He had more chest pain. He had another cardiac arrest. He died. Now, his life would not have necessarily been saved by having a cath lab here in Nanaimo, but his access to that service was significantly delayed. And it was delayed because we don't have access. And we need more access on the island. We need access here. The second case I'll tell you about is a 62-year-old woman who came into our emergency department a few weeks ago at 11:30 at night. She'd never had heart disease before. She had chest pain. She was having a heart attack. She got the clot-busting drug. An hour later, she was still having chest pain. Her cardiogram still showed evidence that she was having an active heart attack. She was referred immediately and accepted by South Island, Victoria. And she was brought down there. The difficulty is that she's in our emergency department. There's no transportation services at night. She can't just go down in a regular ambulance. She needs a critical care team or a nurse to go with her. We can't take nurses out of emerge easily or out of ICU when they're attending other patients. But they eventually found someone. They got her down there as fast as they could. She got into the cath lab at 4 in the morning. 4.5 hours after she presented with her heart attack. And the cardiologist noted that she was no longer having chest pain. Why? Dead muscle doesn't cause pain. She had completed her heart attack. So she got her angioplasty, she got her stent, but she had a reduction in heart function. She had a wall motion abnormality because the heart muscle had been damaged. So she suffered because she did not have access to the right service here in Nanaimo. The third patient is one that I saw this week that has made me particularly angry. 63-year-old man who, again, had no heart disease. All these patients live in Nanaimo. They're not in some remote area. He presented to hospital at 3:30 in the afternoon. He was having a heart attack. He got the clot-busting drug. It didn't work. And next thing you know, his blood pressure was falling rapidly. He was put on medications to try to support his blood pressure. They tried to resuscitate him. He got worse. His heart stopped. We spent 40 minutes trying to resuscitate that patient. He died. He died because he did not have access to a heart catheterization here in Nanaimo. That is why we need this in Nanaimo. Next slide, please. This is the response from people in this is Island Health personnel in Victoria. This is what they tell us. You chose to live in Nanaimo. You get the care you deserve. Next slide, please. So this is the access that they have in Victoria to emergent heart catheterizations. So this is the population that they can serve because they have local availability of heart catheterization, basically up to Duncan. Next slide, please. If we had a heart catheterization program here in Nanaimo, we'd be able to serve all the way up to Campbell River and down past Duncan. That is all within that 90-minute drive of Nanaimo and out to Port Alberni. Next slide, please. And if we have both catheterization services, we can serve population, most of the population of the island, more than 80%, as opposed to less than 40% that is now served with urgent catheterization in Victoria. Next slide, please. So what has Island Health done about this? Well, it is a litany of promises and a legacy of failure over 20 years. Howard Waldner, who was the first CEO of Vancouver Island Health Authority in 2006, came to Nanaimo and announced to us that you will have cardiac catheterization services within 10 years. So we should have had them in 2016. Here we are 9 years later, and it's not even promised. They have commissioned instead, Island Health, 5 studies, 2006, 2010, 2013, 2024, 2025. Every one of them has identified that we need a catheterization service in Nanaimo. In fact, they then recruited Arun Natarajan in 2014. You may remember the announcements. We were thrilled when we had a cardiologist come to Nanaimo in 2014, and he was recruited to build a cardiology program here. Excellent. He recruited cardiologists. He built it up to 5 cardiologists. But we were frustrated because we could not get Island Health and cardiology in Victoria to support the development of catheterization services. So Dr. Natarajan and I approached Cardiac Services BC. We provided them the data. We showed to them the number of catheterizations that were required, the number of heart attacks that happened, the fact that we had a good group of cardiologists. We had a critical care unit to take care of these patients. And Cardiac Services BC said, yes, you meet all the criteria to get a catheterization lab. All you need is support from Island Health. What did Island Health say? No. As a result, our cardiologist left. In 2021, Arun left, went to Ontario, and left with one cardiologist here who has now, as Donna has mentioned, left the hospital. And there's only one new cardiology recruit who's hanging on here. Next slide, please. No cardiologist trained in the past 30 years has ever given a clot-busting drug. They don't know how to do it. This is a last-century medicine. The failure of Island Health to support development of cardiology services, particularly a catheterization program, means Nanaimo is a place, as a cardiologist, for your career to die. It's not to grow. As a result, no cardiologist will come to Nanaimo without a commitment to a cath lab. Now, what Island Health says is that we need to build a program. We need to build up the cardiology program, and then we can get a cath lab. We already tried that in 2014 with Dr. Natarajan. It didn't work. Because as long as there's no commitment to a cath lab, it ensures that no one will come here and our community will be denied a catheterization service. As recently as July of this year, Kathy McNeil said that a new cardiac cath lab is subject to multiple levels of approval through the government. Well, duh. It would be premature and irresponsible to commit to a definitive 3-year timeline for a cath lab. That was this year. Next slide, please. So the question is, what can we do about this? We as a community. Well, first of all, Island Health administrative leadership and the board need to be held to account for this failure over 20 years. The second thing is Mr. Eby made a promise. All the parties made a promise. They need to keep to their commitments. But I want to point out that our community has proven that we are committed to better health care delivery for the residents of Central and North Vancouver Island, even if Island Health is not. My hat's off to the leadership of the regional district, Janice Perino and Ian Thorpe particularly, who have championed increase in our property taxes in order to develop significant funds to support healthcare infrastructure. Now, no one likes to pay taxes, and most of the people in this room own property where we're paying a lot more money than some other people. Proportionally, it's the same. And no one is happy about having to pay more taxes. But you know what? This has given us over $100 million for healthcare infrastructure here. And that is really, I think, it is incredible foresight to have developed that fund. The second thing is that we have an excellent leader in Barney Ellis Perry in our foundation who's been incredibly effective in raising funds to support projects such as our ICU and the Cancer Center. Indeed, Barney has been given $3 million without there even being a promise of a cath lab. $3 million towards a catheterization suite. Next slide, please. So what can we do? The RDN can commit the full funds to build a cath lab. The foundation can raise funds. Once a cath lab is promised, they can have a campaign to raise funds that will offset that financial commitment. That doesn't allow the government off the hook. We are in a financial disaster, as everyone knows in this province. We have no money. We're virtually bankrupt. But by our putting the money up front, it allows the government to defer their contribution until our provincial fiscal situation improves. Next slide, please. But there's a quid pro quo to this. By our committing to make this financial commitment, there must be no delay in building a cath lab. It needs to be built within 3 years. Furthermore, the Nanaimo community must have control over the development of cardiology services in a cath program, with Island Health being accountable to us, because we're the ones that are paying the money. And to do that, cardiology leadership, which has failed to support cardiology service delivery in Central North Island for 20 years, needs to change. Island-wide control of cardiology needs to be in Nanaimo, not in Victoria. Victoria needs to be subservient to Nanaimo. Next slide, please. What do we need from our provincial government? We need your commitment, Ms. Higginson, to support the development of cardiac catheterization services within 3 years, recognizing that we will put the money up front here. We need also for you to direct Island Health, which doesn't seem capable of doing the right thing, to ensure the Division of Cardiology is required and its leadership restructured in order to achieve and ensure the best care is available for all patients on Vancouver Island. Next slide, please. So in conclusion, the time for action on a cath lab is now. It is the residents of our community who suffer by not receiving accepted standard of care and who are left to grieve for those who die as a result. It is the medical community that bears the moral anguish of being unable to offer heart and life-saving care. It is Island Health and the Division of Cardiology who bear culpability for failing for 20 years to provide this critical service. But it is the continued inaction by our provincial government that means our blood will be on its hands. Next slide, please. It is no longer acceptable to say that just because you chose to live in Nanaimo, you should get substandard care. That is just not acceptable any further. I am so angry after what happened this week with that poor man who did not need to die. And the medical staff are angry. That is why within a week, more than 90% of our staff signed a petition demanding this service. And we will work to get that service for our community and for our patients. Thank you.
Well, there's nothing really I can add to that other than to say thank you, Dr. Forrest, for being on the front lines every day. There isn't a day I don't think about you and the work that you and your team are doing at the hospital, and just thank you. Our next speaker is Dr. Neil Schwartz. Neil is an internal medicine doctor who has been working in the cardiology field for the last number of years, and I'd like to invite him up this evening to speak to us about the system. Neil.
Yeah, good evening. It's always very hard to follow Dave Forrest. I think that was a very, very thorough review. We should have compared slides because I basically don't have a lot more to add to what Dave said. I'll just review a few points. Yeah, Dave covered it really well. So what we're all here for, what we would like to see, what we should have had a long time ago, because really, you know, I've been in practice for 30 years, since 1996, and most of that experience has been here in Nanaimo. I've also worked in various hospitals in Vancouver. I did my training in Ottawa. Oh, wow, I'm going to break out into a song. So yeah, I did my training at the Heart Institute in Ottawa. And as I said, I've worked in various hospitals in Vancouver, so I have a lot of experience and perspective. And also, I'm very familiar with the disparities in care within different health authorities and within different provinces. And I'd like to report in the last 30 years that I've seen cardiac care substantially improve for citizens in Central Island and Northern Ireland, and I'm afraid I can't say that's true. It's extremely frustrating. I'm sure you're all wondering what is going on here. Like, how could this be? I'm sure you're angry, confused, you have a lot of questions. How could your health authority and your politicians let you down, right? It's just shocking. So this is what we're all hoping for, that NRGH becomes a cath lab hub. This is the only way we're going to attract cardiologists to our community. You know, you can't get surgeons to come to your community unless you have an operating room, right? So we've heard from Dave, made the point very well. We recruited cardiologists. They left because they weren't supported. Our health authority let them down. And part of the reason is the cardiology group in Victoria. They have something, they're responsible for a lot of the fact that we haven't progressed in 30 years. And every other health authority in the province and in the country is working hard to develop a cath lab hub in populations such as ours, where basically 500,000 people would have access to a cath lab if we had one here in Central Island. All of these communities are within that 90-minute, 2-hour window, and so many citizens would benefit. The majority of citizens on the island would benefit. The majority of angiograms that are performed in Victoria are on patients who live outside of the greater Victoria area. In fact, Duncan was a 45-minute drive from the Royal Jubilee Hospital. Many patients from Duncan, if they come into hospital with a STEMI, a major heart attack, they're still getting thrombolysis. They're not going directly to the cath lab, even though it's a 45-minute drive. This just shows you how overtaxed, how overburdened the system is, that the cardiology group in Victoria cannot even look after their own patients in their catchment area. They are so overwhelmed with cases. It's shocking, and yet they are not really that supportive of another cath lab hub on the island. Next slide, yeah. So, I mean, Dave's gone over a lot of this. PCI is the percutaneous intervention. That's where you get an angiogram, plus you get a balloon and a stent to open up that artery. That's critical. It's the standard of care. Every health authority in the country is trying to provide this for the majority of their citizens. Our health authority has been very slow, let's face it. I mean, since I've come to Nanaimo, 30 years, our group recognized that we needed a cath lab in Nanaimo. And yet, we still don't have a plan, a firm one anyway. Sorry, if you could go back to that other slide. I was going to make a few other points. Yeah, so in Victoria, you don't get thrombolytics. Nobody gets thrombolytics in Victoria. They don't get thrombolytics. Why? Because they're inferior. Why would you give thrombolytics when you have a cath lab? It should be evident to everybody here. Thrombolytics kill people. You can have a brain bleed. They're clearly inferior. If you asked 1,000 cardiologists, would you rather have the clot buster developed in the 1970s, or would you prefer to go straight to the cath lab to get percutaneous intervention with a stent? 1,000 of them are going to say, primary PCI, I want to go straight to the cath lab. Don't give me the clot buster developed 50 years ago. So we're still providing the same care, from 50 years ago here in Nanaimo. Basically, I mean, sure there are a few medications that have helped, that have been developed, that have reduced the mortality from a heart attack somewhat, but it's still not that much different. And so, yeah, we're going to have, if we had a cath lab hub here in Nanaimo, we're going to be able to, you saw the hub, so many more communities are going to benefit. We're obviously going to see reduced deaths, heart failure, brain bleeds, reinfarction, and readmission of patients. We have the 50% higher readmission rate for heart attacks at 30 days. 50% higher than in Victoria. So some patients, you send them home, they're going to reinfarct. Well, Nanaimo has a much higher rate of that incidence. So as I said, 50%. Also congestive heart failure. We do very poorly with in that realm. We have a much higher burden of congestive heart failure in Central Island and North Island. And I mean, if I have a heart attack right now, a massive heart attack, it's a Thursday night. Okay, I'll be the guinea pig. And I'm going to go to the NRGH. The emergency room doctor is going to be really sweating because he knows who I am. And I'm never going to see a cardiologist. I'm going to get thrombolytics because there's no other choice. An hour later, they're going to hope that my pain in the chest has gone away. And, I could have a cardiac arrest at that time. Then if it doesn't go away and it looks like my heart attack isn't responding to the clot buster, which is what happens very often, they're going to have to get on the phone, talk to the cardiologist on call, and sometimes we have to beg for the cardiologist on call to take that patient from us directly for what we call rescue angioplasty and stenting. They're not keen to see extra cases. They're already overworked. They provide excellent care, but you have to get there first. So it's, and if it's in the middle of the night, I mean, they would much prefer that we admit our heart attack patients and we take that case the next day or sometimes 48 hours later. Let's say it's a Thursday night. If I have my heart attack now and I actually respond to the clot buster, meaning that part of the clot that's sitting in my artery that's plugged up with plaque has responded, there's been some response, I'm still going to need a stent. I'm going to have both procedures. But if let's say I have a response, I'm going to be admitted to hospital, never see a cardiologist, and because it's a Thursday night, I'm probably not going to go down tomorrow morning, which is Friday, which means I'm going to sit in hospital Saturday, Sunday, and like Dave's example, I could have a cardiac arrest on Saturday night. I could re-infarct. And they've already given me thrombolytics. What are they going to do? Give me thrombolytics again? So, and then finally on Monday, if I make it through the weekend, I'm going to be transferred to the Royal Jubilee for the stenting. So this is atrocious care. I mean, this has been going on for decades. And what's the care you're all going to get? The bean counters want you to believe that this is the most efficient system. Well, look around. None of us, do any of us look like beans? It's really actually not proven to be that efficient. The cost effectiveness of this is questionable, given that hospitals up and down the island are basically functioning as parking garages for patients that have been admitted with heart attacks while they wait their turn for Victoria to say, okay, send them down. It's a huge burden on our transportation network, huge cost, and a lot of collateral damage with harm caused through congestive heart failure, brain disease, a lot of inconvenience and cost to families. Families have to go down to Victoria, spend the weekend there while their loved one is in hospital, and at their expense as well. Yeah, I think a lot of this has already really been covered. Next slide. And if we actually had a cath lab hub here, it would improve the care of patients in Victoria, because many Victoria patients can't access their own cath lab because they're dealing with patients from up island as well. So it just makes so much sense. And the outpatient wait list, this is another thing that we haven't really discussed, but Dave mentioned a couple of patients who are waiting in the outpatient. I had 2 patients this week in my office, one of which had angina. I put him on medications. I requested an angiogram, and he basically had to spend 5 months waiting. And it's just shocking. 5 months. He had no summary. He couldn't do anything because he was getting chest pain. He finally had his angiogram 2 weeks ago, and he was admitted for emergency bypass because basically every artery was 95% blocked. He could have died any second. This isn't unusual. I had another patient who was waiting for an aortic valve replacement, a TAVI procedure. You'd have to have an angiogram prior to having your heart valve replaced. She as well had to wait 5 months. Meanwhile, she's short of breath. She can barely function. These are everyday stories that the health authority seems to be not so excited about. It's, why can't we have the same fantastic care that Victoria area patients get? We deserve better. I think a lot of this has already been said. Next slide. So a couple of things. Let's make a couple of points. I've been around for a long time, and in 2006, I met with Dr. Higginson, who was the current, at that time, the site chief for Victoria Cardiology. He's actually a cardiologist from the Heart Institute in Ottawa, where I trained. He was one of my teachers. And so we met in 2006. I was the site chief at that time, and he did an in-depth review of cardiology at that time in Nanaimo. He met with, he reviewed the cardiac the situation in Victoria. He made many recommendations, including that we needed a cath lab. And that was 2006, 20 years ago. So I called him a year ago, and I spoke to him. He was still practicing. He's like in his 70s. He's an eminent cardiologist. And he was disappointed to hear from me that nothing's really changed, and that we've gone from 5 cardiologists to 2. And he came up with a couple of reasons, and he said, well, follow the money. And he said, you need to be in charge of your own cardiology unit here in Nanaimo. So those are 2 very interesting things I can share with you. And last year, we met with Dave Copeland from Fair Care, and myself and a number of others met with our former deputy minister and the CEO of the health authority, and to discuss, why we didn't have a cath lab. And he mused, well, it could be done within 3 years. He himself knew that it was feasible, but the demand for a cath lab just isn't coming from the health authority. It's the demand, the need for such a, the case for a cath lab basically hasn't been great enough. I think I'll just wrap it up there, because I think the most important thing is to answer your questions. I'm sure you have many after this presentation.
Thank you, Dr. Schwartz. Appreciate you sharing your experience. Our next speaker is a very dear friend a very, very busy person in our community. That's Barney Ellis Perry. He's the CEO of the Nanaimo District Hospital Foundation. We've asked him tonight to share a little bit with you about what he's been working on the last year and what you can expect to see from the foundation. Barney?
Did you notice that Donna's dressed in the Fair Care colors? I just wanted to point that out. Please, it's very important. I'm going to be really quick because it's very hard to follow two amazing doctors. I just was asked to speak to you about some of the work that is happening with your hospital foundation. We are here to respond to your needs and the community's needs. And what I love about tonight and about the speakers you'll hear, we may not always agree on how we're going to get there, but we all agree we need to get there. And so we really appreciate Stephanie being here, Janice being here. We're all going in the same direction. It's just a really tough road we have ahead of us. So as was mentioned, we've had donors come forward. We've had over $3 million committed to a cath lab. There is no campaign. I can't run a cath lab campaign because we don't have a commitment. Once we have that commitment, we can raise the money to really expedite this project and do something really powerful for our commitment, our community, alongside the Regional Hospital District's commitment. And maybe if the government isn't able to come up with their funds, maybe we have to all do that as a community. And there are some volunteers in our community who think we can do that. We have commissioned a study on what it would cost to build the cath lab, to look at the options. We've had all these conversations, but we don't actually have any data. And at the foundation, we try to be really innovative, and we try to really support the thinking of the health authority, the Regional Hospital District, and others. So we have a study that is underway right now. It's in draft form, but the leading option right now, and this could change, but the leading option is to have a standalone cath lab very close to the emergency and our beautiful new critical care building that many people in this room have supported for $10.5 million. And that is coming in at around $40,500,000. It's a lot of money, but in relation to everything you've heard tonight, it's not a lot of money. And these patients are already they're in the system, they're costing the system money. It's not like we're creating something brand new. So we have to get behind this, and it's actually a very reasonable lift. We have also proactively done a little work to support Janice in a conversation she was having with the Minister of Health around, okay, what will a business case cost? We're all wanting to see that happen. So what is it going to cost? So we had this consulting company that does that for health authorities across British Columbia, for hospitals and other major projects, and it's about $3.5 to $5 million. So we're like, we can do that. So there's a lot of work being done behind the scenes to prepare for when we have a commitment. And so it's so powerful that you're all here tonight to help propel that conversation. And we want to thank Fair Care, which is a volunteer organization, who have been putting all of this together. It's funded separately. It is not part of our foundation. It's funded through another foundation. It's volunteer run. And it is pretty phenomenal to harness your horsepower, to harness all of your desire to see better healthcare in your community. So I'm going to turn it back to Donna and on to your conversation.
Thank you, Barney. It's a pleasure to be working with you. Your inspiration in our community. Thank you. We're going to switch it up a little bit. We're going to have a fireside chat right now. So I'd like to invite Stephanie Higginson, our MLA from Ladysmith, Qualicum area, to join me on the stage, and Janice Perino, our Regional District Hospital Board Chair. That's a mouthful, Janice. We're making an acronym. Also going to invite our previous speakers to come up. So we're putting our screen away. Hopefully there's a little more lighting in this dark area. We're going to take a bit of an opportunity to provide some questions. And I just want to start with a quick introduction. Stephanie Higginson should be no stranger to you living in this neighborhood. She was first elected as MLA for this area in 2024. She is the chair of the Government Caucus. Before being elected to legislature, Stephanie was twice elected to the Nanaimo Ladysmith Board of Education and served as the past president of the BC Schools Trustee Association. Stephanie's also a former secondary school teacher. This is what grabbed me. That's like an impossible job. With an MA in Educational Studies for UBC. Stephanie and her husband live on a small farm in Cedar with their 2 children. So thank you tonight for joining us, Stephanie. Janice Perino. Janice is a City of Nanaimo Councillor and Regional Director I'm going to back that up. She's City Council and chair of the Regional Hospital District Board for the past year. She has previously served as CEO of the Nanaimo District Hospital Foundation, so she directly preceded Barney in his role there, so she has a good background in that fundraising piece. She's also served as vice chairperson to the Regional Hospital District. Janice also has 12 years experience as councillor and mayor of Summerland, and on the regional district as a director in that area. Janice has served the Nanaimo City Council since 2022. So join me in welcoming our two guest panelists. So I want to start the fireside chat off with a statement, because Barney was gracious enough to point it out that everybody at this table comes from a different perspective, but we're all moving in the same direction. And these are really difficult conversations. And what I do want to let you know is I've had the opportunity to work with both Stephanie and Janice, and I'll let you know that they are working really hard behind the scenes on healthcare and many other issues that face our communities. But tonight we're focused on healthcare. And so we appreciate you coming out to speak to us tonight and being upfront with us about what's really going on from your perspective. And as Barney pointed out, everybody's going to have a different perspective. So I'm going to start the questions with Stephanie. Andrea's going to be our kind person handing out the microphone. Stephanie, since the Tower campaign promised 12 months ago during the provincial election, can you provide us with an update on what government has done to get us closer to a hospital tower build? And can we expect that something will be in the provincial budget moving forward that will help us set concrete dates around that build time? Understanding the background, we understand that's a 8 to 10 year build out time frame.
Thank you, Donna, and good evening, everyone. I'm nervous. I do want to start also by acknowledging that we are meeting today on the traditional territory of the Nanoose, and I am grateful to them for their stewardship of this land since time immemorial. And I want to thank Dr. Forrest and Dr. Schwartz for their stories. Dr. Forrest, a few years ago when I was president of the school trustees working through COVID, you were our only infectious disease doctor in the Central and North Island region. Your commitment to 24/7 care for patients is unwavering, and I'm grateful to you for your stories tonight and for the care that you give to both of you. But our relationship goes back, you might not remember it, but I do, and it was a really important time, and I was grateful for your guidance then, just like I'm grateful for your guidance now. So to answer this question, I wish that there was a really snappy 3-word sentence question that I could answer, that I could give you, but this, as you've pointed out, is quite a process. So, a commitment was made during an election just about a year ago. What's happened since then? One, we got elected, so that's important. We got sworn into government, and one of the things that this government did was stand up a Ministry of Infrastructure. And the reason for that was to make projects go quicker and to have them become more fiscally responsible. So that's one major step. It feels really removed from this process, but one of the reasons why that ministry was stood up was the recognition of the need for capital projects and the need to make them move faster and cost less. And so that's a big step towards this project, because this project is, probably $1 billion, $1.5 billion project. And so we need to make these projects move faster and cost less. So that's one of the things that's happened. One of the other things that's happened is there was a bill passed last spring, and people think all this stuff is really far removed from our hospital tower. But these are all things that are going to help us get this tower faster and in a more cost-efficient way. And that was the Infrastructure Projects Act, designed to allow us to streamline processes. And the goal in that is that it will actually then allow us to take less time by recognizing, because this government has done a ton of capital infrastructure, perhaps, as you pointed out, there is a deficit right now, because there was a capital infrastructure deficit, and we're trying to catch up. And so through doing all of those projects, we recognized that there's a need to be more efficient, and that's what that bill will do. It creates a streamlined process for projects of provincial priority, like a hospital tower, like a school, in order to allow them to move quicker. And so we did that as well. And then as well during, I became your MLA because this matters to me. It matters to me deeply. Before I got here today, I talked to my mom on the phone, who was driving home. I didn't ask for permission to say this. Sorry, Mom. It's not a secret. Who's driving home from cancer care in Victoria, my 82-year-old mom. So this matters. I'm here not just as your MLA, I'm here because I care deeply. I'm somebody who is impacted by this as well. I live in the community. I know what it means to go to this hospital. I know what it means. I have good friends who work in the hospital, who work with these doctors. I know their stories. I know it matters, and that's one of the reasons why I am your MLA. So during the campaign, before I was even elected, I met with Donna. I wanted to understand the process, so I met with Donna. As soon as the Minister of Infrastructure was sworn in, I called that Minister of Infrastructure and I let them know how important this project was to this community. I let them know that our regional districts were increasing taxes and that you're expecting to have it because you're paying for it and we need to show progress on it. I had Janice down for, I think it was the budget or the throne speech, the budget, and arranged a meeting for her that day with the Minister of Infrastructure so that the minister could meet Janice, could build that relationship, because this business case that Barney is talking about doing is an unusual step. It's not normal. So if we're going to get the okay from that, we need to build credibility. We need people to know that it's important.
You also introduced me to the Minister of Health, to the Minister of Finance, to the Premier. That's what your MLA did. It was a good day.
Mm-hmm. So I've been working on this behind the scenes with Janice, with Barry, with Donna, and people want to see something tangible, and I understand the desire to want to see something tangible. This is, like we've said, about a 10-year process before the doors open. And before something appears in the budget, there's about 5 or 6 steps, and each one of those steps is about 12 to 18 months. So we're going to see, we're working towards that.
That's 6 years.
Mm-hmm. This is a very long process, and it requires us all to be working together and to be pulling together in the same direction. And so, I understand that. I've heard someone just say 2006. I understand that. I can't answer for what happened before I came here. But what I can tell you is that I'm working really hard on this.
So I guess, sorry, I just want to interrupt to say, there's going to be a chance to ask some questions after. I don't want to interrupt, Stephanie, what you're talking about, because I think you make some good points about what you've done in the last year. That's what we've asked you to come and speak about. And then we'll come to the other. So I just want to let you know there's going to be an opportunity to ask some questions after we finish these.
So the process, I'll wrap it up quickly. The process is that there's a needs assessment. Island Health, although we've heard terrible things tonight, has agreed, we know this, that this is an important project. It is the #1 capital project left in their mind on the island right now. It's the #1 capital project. There is a concept plan for this hospital that it was 2-phase. The first phase has been delivered. The last part of that phase, the ground is about to break, and that was the HAU, the ICU, the cancer care, the ground's about to break, the long-term care. So all those things have been done. We've delivered those. We have a track record of delivering on our promises, and we intend to deliver on this one. This one takes time. The next step is the business case. So we have the concept plan. The next step is the business case. That's where we're at now, step 3. So when I said all those steps, we're not at the beginning. We're at step 3. That's the business case. And that's the place where we're at right now. And that's the place we're working really hard to be able to get that green light for the creative solutions that the Regional District Hospital is proposing. So when you heard those time frames, you all jumped right that we were at the beginning, but we're not at the beginning. We're at step 3, that's about 12 to 18 months. Then it goes to Treasury, that's about 12 to 18 months, and then you see it in a budget once it gets approved by Treasury.
Okay. Well,
so that's where we're at.
Let's move over to Janice as the chair of the Regional Hospital Board. Our specific question for you is, we'd like to know specifically in the last 12 months, what has the Regional Hospital District Board done to move the patient tower conversation to the forefront of government's priority list? And what leverage are you using to do that work? Now, Stephanie spoke a little bit to that, so we're going to ask you to keep this a little bit tighter,
Sure.
because we do have a couple other questions before we move out to the audience. Okay?
So, this did not just start yesterday. The former chair of the Regional Hospital District, Ian Thorpe, who is also a councillor in Nanaimo, did a ton of work. And one of the things, and it's a nasty thing to say, you raised the taxes. In fact, you were paying 28% towards, what we're doing is putting the money away for future hospital projects. I got elected in January, and our board discussed it at length, given what was happening with the United States, given what was happening with the economy. We brought the 28% down to 21.5, which is where we're sitting today. I have had probably 30 interactions between Island Health, the ministry, the different ministries, including the work that Stephanie has done, MLA Higginson, as well as the doctors that we've dealt with, Barney through the Hospital Foundation. The list is endless. We are not giving up under any circumstances. The very first thing that we did the day that I got elected as the chair was to say, our board passed a motion that we will pay for the business plan and the concept plan. Now, I can tell you that this is not my first time doing this. We did this where I was in the Okanagan. We got the hospital expansion. The actual business plan and concept plan at that point was $2.5 million. This is back in 2012. Barney was saying that it's about $3.5 million. I've been told by various sources that it's a minimum of $10 million, could be more. So, you know what we said at the Regional Hospital District? We'll pay it. We'll pay it up front to get it going. Whatever it takes, we will pay it. That's what your tax dollars will be used for. We also said very clearly that for the cath lab, because it's the first phase of the hospital, and we're going to pay 40% anyway, right? So out of our 40%, we're paying that business plan and the concept plan, we'll pay for the cath lab up front. So the government doesn't have to put out any money, and it will get it done a whole lot faster. But I want to talk to you a little bit about the timeline. Greg Scott, I want you to stand up. I want you to stand up. I'm going to embarrass him. He is the former chair of the hospital, of the Nanaimo District Hospital Foundation. Greg and I wrote letters back in 2016 for the Cancer Center. They're going to break the ground this month. Greg and I went to meet with, at that point, the Minister of Health, Adrian Dix, with Leonard Krogh to fight for the ICU and the HAU. The HAU finally opened. I promise you, no matter what we do, we will not give up, no matter how tough the going gets. We are going to stay with this until we get the doors open. We're living proof. It works. Persistence works. We'll be gracious about it, but persistence works. Sorry, I'm throwing you off, Donna.
No, it's like fantastic. Thank you, Janice. So one thing I was hoping you would share with us, though, quickly, is by the end of 2025, how much money will the RHD have in reserves to put towards some of these health? You've just talked about
Yes.
funding the cath lab up
That's
front.
right.
You're doing the business plan. How much money is going to be there?
So there was a comment made by one of the other MLAs, well, you just get in touch with us as soon as you've got $100 million in the bank. Well, guess what? By the end of this year, we will have $100 million in the bank. So bring on the project, because we're ready. Now, I want to prepare you that, as Barney said, 3.5 for the business plan. It should be 3.5 million. It's probably not going to be. It's going to be between 10 and probably 50 million. There's no doubt about it. Surrey was probably double that. What we're doing is a major construction project with the tower and the cath lab. As far as the cath lab, we've been told the minimum cost will be 40 million. Minimum. I don't care if it's 80 million. We'll pay it up front if we need to. That's what our tax dollars are about. So we have made it very clear, no matter what it takes, that is the first phase. But I'm telling you, it will come out of our 40% that we will all pay, me included. It will also be, it's a portion of that, right? right? We're going to put the money up front to make sure that it happens. But I will not sign off on the money for the cath lab unless they agree at the same time to do the hospital tower expansion. But the phase 1 is the cath lab, because it can be done, as Dr. Ford said, in 3 years. So do it. The tower will take longer, but they have to agree to doing the tower at the same time, because you don't just need the hospital beds, you need the tertiary programs that we're lacking, plus more operating rooms, plus more imaging rooms. We are going to get what our city needs, what our residents deserve, and what they must have for the long-term future for you, your children, your grandchildren, and everybody who's moving here. And that's just the way it's going to be.
Stephanie, you've heard lots. I know none of this is a surprise to you, because like us, you're living in this community. You shared your personal story. I appreciate that. But you've heard lots tonight about the conversation about our immediate need for a cath lab, and Janice has spoken to that as well. Thank you. So the Premier spoke very briefly about this last year during the campaign. What is the province's official position on getting cardiac services out to Central North Island on a fast-track basis? And as you've seen, we're really talking about this 3-year term. What can you tell us about that?
Well, I can tell you that luckily it's not my decision to make, which is not what everybody wants to hear. But what I can tell you is that I'm here tonight because this matters, and I'm here tonight to be your voice. And what I need, why I came is to hear these stories. These stories help me advocate for our community, and that's what I'm going to do. And that's what the other MLAs who are fighting for this, Sheila Malcolmson and George Anderson, also really believe in making sure that we get these projects across the finish line as soon as possible. So, I was really disappointed to hear about the fractured relationship with Island Health, because what I know is that this decision has to be made together. I know we have to fix this relationship in order for this decision to be made. It's not my decision to make about the when. It's the Island Health and the medical staff in the hospital to work together to get it done, and that's what needs to happen. And if I can play a part in bringing that relationship back together, making sure that people make this decision together, then that's what I will do. But I'm going to make sure that I advocate strongly for our community, that they get the services that they need, and that they have those services that they need when they need them, where they need them. That's really important. And I think so far we've done a good job. $750 million in the Central Island region in the last 7 years. And we're going to continue to deliver on that. It's really critical. The Minister of Health came to the hospital not only to see the good stuff, she wanted to see what people were proud of, but also to see the places that were the hardest for people to deliver the care. And so this matters to her, it matters to me, and we're going to do our best to make sure that this relationship is repaired so that the people who have the right training can make this decision. I've heard clearly why this is important to people now, why you need it now. I've heard the stories about why you need it now, and I'm going to be your advocate. But I'm not going to make promises to you about things. I can see someone rolling their eyes in the back. I can't make promises to you, and I'm not going to make promises that I can't keep. I'm going to be your advocate for this, and I'm going to make sure that the Central Island region gets the care that they need when they need it, and I'm going to make sure that the people who have to make these decisions together are in the same room making them together. That relationship is the most important one in this decision. That relationship is the most important one, and we need to bring those people together to make that decision. And I think it's fabulous that the hospital board or foundation has done all this work. We are showing people that we're ready to do this work, and that in this time, as has been indicated, this really critical fiscal time, we have to be creative, and we have to show that we're willing to do things differently, and we have to show that we're ready to come to the table. And I think that we are so fortunate in this region, because the regional district hospital, the foundation, everybody is pulling together on this, including your local MLAs. We are all fighting hard for this, and we're going to keep fighting hard for it.
Thank you. We're going to move to the floor to questions. So I apparently have someone out in the audience with a microphone. It's John. John is at the back. Do I have any questions? He'll come to you if you put up your hand. Oh, behind you. I see someone behind you. John, there's people behind you, there's people in front of you.
Good evening, everyone. Can you hear me?
Yes.
Awesome. Could I have a raise of hands of who used to be a nurse back in the day?
How many people here were nurses?
Right on. Do you remember, I have a friend, thank you very much for your services. I have a friend way back in the day that paid $200 for her yearly license. And then she got trained on the job every year. And as far as I know, she's still a nurse. By the way, my name is Janet Wagelt. I'm a contractor. I've lived all over this island. So what I'd like to make a suggestion on is the buddy system for elder nurses to train the younger nurses after their first year of studies. It would alleviate an incredible amount of pain and, what do they call it? Overexhausted people in the health industry. Okay, wait a minute. I got one more thing to say. I want you to think about these things. I hear what we're all doing here. We're trying to do something right. Well, I need to say this because it's been bothering me since COVID. Nurses are quitting, doctors are quitting, but we're not stepping up together, and that's what's really making me angry. Just like you, Dr. Forrest. I feel bad for all your patients. And the people who have mental health issues, I suffer from PSD. Right now I'm shaking in my boots. Okay? But I'm up here and I'm full of courage and I want to see this change. And it starts with, please don't do that. No, I know, I need to say something. It's important because it might be on a bunch of your minds. Okay? Thank you. Right? So somebody like you all, we all have to stand up to our government. I'm tired of paying my taxes and seeing nothing done. There's a building in Nanaimo, I think it used to be the Travelodge Hotel. It's been empty for years. If we only need 3 years to build it, let's get it done. Tear it down, get people in there. You can even bring mental health issue people in to train them to work there, because they're willing to do it. But this government keeps stopping what the programs are here to do, and please just think about that. My name is Janet Waggle again. Thank you.
Thank you very much for sharing your thoughts today. Mentorship is a fantastic program, and I might mention the old Travelers Lodge. You're about to see that reopen. The municipality and the regional district and the province have all partnered there, so there is stuff coming. John, who are you sending to us next for a question?
There was somebody here. This guy here was, I think, he was just a little before.
I don't really have a question.
You don't really have a question?
I just, I'm
going to control the microphone.
I just want to thank Dr. Forrest and Dr. Swartz for wonderful presentations. I'm a retired physician. I'm from the Okanagan. I moved here 18 months ago. And when I was living in Kelowna, cardiac care was in trouble. And the heart surgery program was funded by people in the community. And what I can tell you is, if you build it, they will come. We're not going to get interventional cardiologists here unless there's a cardiac cath lab. So let's do it.
Thank you. Yes, brilliant. John? We're only going to take a couple more questions. I realize that there is a Blue Jays game tonight, and so I'm trying to get you out of here in an appropriate time.
One of the doctors mentioned before that there was some resistance from the cardiology department in Victoria to having something up here. Why is that? How do we remove? Are they blocking? And how do we get that blockage removed? Because it doesn't seem they've got enough physicians to take the load from Nanaimo, yet but you made a comment that there was an issue there.
Dr. Schwartz? Hold it close.
I don't have a conflict of interest to see a cath lab come near. I'm sure Dave doesn't either. Except other than the fact that if I have a major heart attack, I'm going directly to a cath lab that'll be in Nanaimo one day. That's our only conflict of interest. So yeah, it does seem we don't benefit financially from a cath lab. physicians in Nanaimo will not benefit. There's zero benefit. So there could be a conflict of interest. It's difficult to understand after what you've heard tonight, especially from Dave Forrest, like why has it taken so long to get to this point? Thank goodness we have fair care. We've never been this organized. So yeah, one comes up with conspiracy theories. We do know, though, however, that there are at least one cardiologist that doesn't support us from having a cath lab. They actually have some data. It's very hard to get data out of this health authority, but they actually have some data that say that suggests that primary PCI direct to cath lab is somewhat equivalent to thrombolytics. So I think the higher ups in the health authority, CEO, etc., haven't really gotten the support from cardiology in Victoria. As I said, every other health authority in the country understands that primary PCI direct to cath lab is the standard of care. As I mentioned before, 1,000 cardiologists would want to have PCI. So why aren't cardiologists fighting hard for us to have a cath lab when they know that hundreds of thousands of people would benefit? So yeah, questions come to mind, and it's I'm not throwing anybody under the bus, but we're all puzzled here, and I think this is some of the issues we're really dealing with, and real world data, as I said, indicates very clearly that primary PCI is preferred for so many reasons. So what's the holdup?
I think, first of all, if you talk to the cardiologists in Victoria, they will tell you publicly that they support the development of a cath lab in Nanaimo. I think none of them would say they support the development of a cath lab in Nanaimo anytime soon, sometime in the next century. So the question is why? And, some of the arguments they will make is the arguments that I presented earlier, that we do not have enough of a base of a cardiology program to support a interventional catheterization program. That is true. We've tried that. They tried that. They were the ones that recruited Arun Natarajan to come here in 2014, then they undermined him. And we lost all of our cardiologists as a consequence. So as someone pointed out, as the physician here pointed out, we need to build it before they will come. That is very clear. The second thing that is a legitimate concern is whether there's enough catheterizations being done in order to maintain skill. And that is their concern. But frankly, as Niels pointed out, 60% of the caths are done on patients north of the Malhat. So yeah, there's a concern that someone's not going to be doing enough catheterization to maintain skill. That's in South Island, not here. So the argument that there are not enough catheterizations to be done in Nanaimo to maintain skill is ridiculous. But those are the arguments that you will hear from them. Are there others? I think that there are, but you know what? I think that they need to be asked that question, why they don't support the development of a cath lab here in Nanaimo in the next 3 years, and why they have failed for 20 years to advocate for it, as Neil said, given the evidence.
Thank you. John, who's our next question? We'll take 2 more questions tonight. John, there's lots of people. So I just want to say, I just want to let everybody know this, is that we have tables at the back where you can fill out the questionnaire where we've asked your questions. They will come back to Fair Care and we will try and respond to those. There's also an opportunity to share some of your stories by connecting with us. And so please make sure you see our volunteers at the back as well. We don't want you to feel like you got left out tonight. John?
Yeah, I'm going to, because I'm totally bald, I'm going to award the next question to the best head of hair in the audience.
Thank you, John. I'm not sure that's true, but my name is Scott. I live in the neighborhood, and I'd like to, first of all, I'd like to applaud many of the past representatives of RDN for having the foresight to actually look at the need for medical health care taxation and a tax levy that's now raised in near $100 million. My question is more related to how, there's clearly an abundant need and a requirement for a cardiac cath lab. And right now, you've heard the horror stories that Dr. Forrest shared with us, sadly. Respectfully, the honorable member of legislature, you've talked about the need for the tower alone and nothing to do with the catheterization lab as part of your dialogue around the 12 to 18 month processes times 2. So I'd like to ask from both Janice and from the honorable member, that we would, what are you doing to actually expedite the catheterization lab with the monies that we already have in the neighborhood, called $100 million?
Great question. Every single meeting where we're meeting with any one of the ministers, any one of our MLAs, and I have to tell you, Sheila Malcolmson, she's been there at all of these meetings, George Anderson, and of course Stephanie Higginson. She might not be, her title might be honorable, but she is honorable. But the important thing that you need to know is that it is one project. It's the tower with the catheterization lab, okay? It has to be both pieces. No, listen, stay with me. We need to have a new tower, but the first phase is the cath lab because it can be built separately and it can be built within 3 years. And by God, I'd be happy with 4 years if we could get it, right? But you have to think of this as a single project because you cannot do one without the other. They have to agree to the tower because it's a 63-year-old building. You need more surgical suites, you need more imaging, you need more beds. We are a tertiary hospital without tertiary services. We must have that. But because the cath lab is one of the tertiary services that we must have, we can build that starting today. Okay, it's a separate build. It can be done today, and we'll pay for it up front. That's what I'm saying, out of our share. You have to think of this as a single project because we're not going to lose the tower for the sake of the cath. The cath is phase 1. We must have both. Don't sacrifice the one for the other. Believe me, you're going to need a full hospital. You need it. John?
Unfortunately, he's also got a full head of hair, so I am biased. But he's been...
Hi, I'm also a physician. I came to Nanaimo in 1997. I'll turn 63 next year, and I'm just wondering when you're having those conversations with the other people in Victoria, in government and other places, are you telling them that as someone who, Nanaimo's my hometown, I'm more likely to die if I have a heart attack, which I might because my father did at age 70, just because I chose to live in Nanaimo? Because that is an actual fact. I'm more likely to die if that happens to me just because I chose to live in Nanaimo than choosing to live in Victoria.
Maybe Stephanie, maybe? That's for Ms. Higginson, thank you. Okay. So this is exactly why I'm here tonight. Because we need advocates and we need fighters. You have them in myself and my colleagues, but I need to hear these stories to continue to be able to fight for this, to be able to make sure that I know and that I can be your voice. This is not a place where politicians come.
Yeah, because they don't have a heart attack.
And so I'm here because I'm going to be your voice and I'm going to fight for you. I can't make promises on behalf of government. I'm way too down the pecking order. I see my former colleague here. He knows how this works. I don't make the promises, but what I do is be your voice every single day, not let the minister pass me by without telling them how important this is. Be the squeaky wheel, talk to the Minister of Finance about why this is important, talk to the Minister of Infrastructure about why this is important, make sure the Minister of Health tours the hospital, which she's done. So that's what I'm committing to you, that's what I can commit to you. I can commit to you that I'm here because this is important. I'm here because your story about living in Nanaimo and feeling that your chances, and it is a fact that your chances of death are higher because you live here with your family's history of heart conditions. These are the stories that I need to have, and that's why I'm here, and that's what I will take with you. That's what I can commit to you, and that's what I'm going to do.
So we are at 8 o'clock, and as you can see, this is a complex, multi-layered conversation that could go on all night long. So as I said, we have paper at the back for you to write your questions out to us. We have, you can reach out to us through our website and through our social media pieces, and we would encourage you to do that. I want to thank our speakers for coming tonight. I know that all of us are very, very busy, and as I told you, Dr. Forrest took a break from ICU to come out. He's probably going right back there now. I want to thank Stephanie Higginson and Janice Perino, Dr. Schwartz and Barney Ellis Perry for bringing the story to you today. Feel free to reach out to us and get more information. Fair Care continues to fight for all of us living in Central North Island, and we appreciate your support. Thank you very much.